Hello, and welcome back to Medicare 101, a guide to the basics of Medicare. Your presenter today is Rodolfo Sierra. I am a licensed insurance advisor, and I do not work for nor am I endorsed by any branch of the U.S. government. This presentation is for educational purposes only, and we will not be discussing any specific benefit information or selling any products in this presentation. Today we'll be referencing 2021 Medigap policy provided by CMS and also Medicare and You 2021 handbook. You can get all this information available online at medicare.gov or any Social Security Administration office. So what is Medicare? Medicare is a social insurance program administered by the United States government, providing health insurance coverage to people who are age 65 and over or who meet other special criteria. In today's presentation, we'll be talking about Part C and Part D, which is offered by private companies who have a contract with CMS. If you want to learn more about Part A and Part B, please watch our other video that goes into more details about that information. As a reminder, Part C is another way to get your Medicare benefits. It combines Part A and B and sometimes Part D prescription drug coverage. The Medicare Advantage plans are managed by private insurance companies that are approved by Medicare, and these plans must cover medically necessary services. However, plans can charge different co-payments, co-insurance, or deductibles for these services than original Medicare. And Part D is Medicare prescription drug coverage. That helps pay for outpatient prescription drugs and may help lower your prescription drug costs and protect against higher costs in the future. Now I'm going to go a little bit backwards in this presentation. I'm going to go into the Part D and then talk about Part C, and it all makes sense once we get to it. So let's start with Part D, which is prescription drug coverage. So Medicare prescription drug plans are administered by Medicare-approved private insurance companies. You can purchase these as standalone insurances in addition to original Medicare and Medicare supplements, or it can be bundled in a Medicare Advantage plan. Part D helps cover the costs of prescription drugs. It may have deductibles and cost sharing with either co-pays or co-insurance based on different tier levels, and the premiums can vary greatly, so it's important to do your research before you decide to go with a specific plan. You must have Part A or Part B to get the Part D program, and you must live in a plan service area. So these programs are specific to where you live, so it's important to get the right plan that's in your specific area. Now, something to note with Part D, there is a potential penalty if you don't sign up in time. You could pay an additional 1% of the average Part D premium for each month you delay enrollment, and that premium will vary from year to year. The penalty is charged every month for as long as you're enrolled in Part D, so for life. So it's important to make sure that when you are signing up for Medicare, then you're enrolling in Part D, even if you might not need it, so you can avoid the penalty, or unless you already have credible coverage through an employer or some other means of insurance. So it's super important to make sure that you avoid penalties at all costs. Another word you'll see a lot in Part D is called formularies. Formularies is a fancy word for saying covered drugs. Each plan will have a different list of covered drugs, i.e. their formulary. If your drug is not on that insurance company's formulary, then the plan doesn't have to pay for that drug. So when you're shopping for your Part D plans, you got to make sure that all the prescription drugs you're taking fall within the plan's formulary. Now, you may request an exception if your drug's not covered, but those are usually hard to get. And also being mindful that formularies can change annually. So you got to make sure during your annual enrollment period, which we talked about in the first video, Part A and Part B, to make sure that it's included in the following year's plan. Now, plans are required to notify members of any changes by mail prior to October 1st of each year. So you should find out from your insurance company whether or not your prescription drugs are covered for the following year's program. But you always want to double check to make sure that your prescription drugs fall in that insurance company's formulary. Another important thing to be aware of, who pays what under Part D. So Part D, there are some costs to it, okay? There are deductibles, there's initial coverages, there's coverage gaps, and there's catastrophic periods, okay? So it's super important to find out what your costs are going to be prior to signing up to Part D plan to get an idea of what it's going to cost you to be under this plan. Now, each plan will be slightly different based on the amount of drugs that you're taking, but on average, you'll see this is kind of where the cost will be on a percentage basis, okay? So initially, there's a deductible, okay? And you as a beneficiary will have to pay that deductible, and that can be up to $480 on an annual basis, all right? After you've paid $480 out of pocket during that initial deductible, you go into what's called the initial coverage phase. Now, during this initial coverage phase, you as a beneficiary, Medicare beneficiary, and the plan will share the costs up to $4,430. So in that initial coverage phase, you will pay 25% of the drug costs, and the plan will pay 75% of the drug costs. So for example, you take a medication that's $100 on a monthly basis, you pay $25, the insurance plan covers the other $75. Now, when you both combined spend $4,430 in those drug costs, you move on to the next phase, we call the coverage gap, or what's predominantly known as the donut hole. In this phase, you'll spend up to $5,582.50 during this period. Now it's combined, it's cumulative. In this phase, there's differentiation between generic drugs and brand name drugs. You will continue to pay 25% of the costs, and the plan pays 75% on the generic drugs. On the brand name drugs, there's a little bit of difference there. You will pay 25%, the plan will pay 5%, and then the drug manufacturer covers the other 70% of the cost during this coverage gap phase. Once you spent that $5,582.50, you move to the next phase, the catastrophic benefit period. This is where your total out-of-pocket costs could hit $7,050. If you reach this point, you only pay 5%, the plan will pay 15%, and the government covers the other 80%. Now, not many people hit the catastrophic benefit period, but the nice thing is that you know that there's some protection in place, so your your costs don't skyrocket. All right? Now, something to take into consideration in this catastrophic phase, that you will stay in the coverage gap or donut hole phase, kind of phase 3, until your out-of-pocket costs reach a certain level, and that level is $7,050. So if you spent $7,050 on Medicare Part D drugs, and that doesn't include any monthly Medicare plan premiums, then you exit the donut hole and enter the catastrophic coverage phase. This is probably one of the most confusing parts of the Medicare plan. That's why it's super important to meet with an insurance advisor who can really break this down for you, because each person is unique and different based on their prescription drugs and dependent on which insurance plan they pick to help cover their prescription drug costs. And don't be alarmed and don't get overwhelmed, because insurance companies do a really good job of communicating each month as to what phase you're in. You'll get a notification or a letter that says you're in your deductible phase, you're in your initial coverage phase, so you'll know where you're spending. But again, you meet with an independent advisor, and they'll be able to walk you through your estimated costs for the year to kind of know where you fall in this phase. Now, the government does provide extra help, or what's called low-income subsidies, will help assist individuals that have limited resources and income to help pay some of the costs of their Part D. If you qualify for these types of extra help, helps cover deductibles, monthly premiums, co-payments and co-insurance, and even participants are not subject to Part D late enrollment penalties or the donut hole or gap. So if you feel you needed the help, you can contact Social Security and apply to receive some extra help from the federal government. So now let's go into the Medicare plan options. Okay, let's examine the most common ways most people fill the gaps or the voids of original Medicare. This is where we start getting into the Part C program. All right, so we have two options when it comes to Medicare. Option one is to keep your Part A and Part B, which is the original Medicare. You can add on a Part D, which is the prescription drug plan, and then you can add what's called the Medicare supplement insurance, or sometimes commonly known as a Medigap, that helps fill the voids that original Medicare offers. Or you can do option two on the right hand side is the Medicare Advantage plans. This is typically known as Part C. These plans are HMOs, health maintenance organizations, or PPOs, preferred partner organizations, that include Part A, B, and D into one plan. Right? These tend to be the most popular because it helps bring down the cost. It kind of bundles all the services into one solution. Let's break down the Medigap first, and then we'll go into the Medicare Advantage plan second. So the basics of Medigap plans. So Medigap, there is a monthly premium that you have to pay in order to have these programs in place, and they help cover that 20% gap in original Medicare, so the out-of-pocket costs are limited. It's guaranteed renewable by law as long as you pay your premiums, and you cannot be canceled or singled out for rate increases. All these plans are standardized, and you'll see in the next slide what those plans are, meaning that if an insurance company offers Plan F as an example, well, another insurance company has to provide the exact identical benefits within the state of issue, but the premiums can vary, but the coverage stays the same. Now, something to be aware of with the Medigap plans, it does not include those prescription drug coverages, so you must enroll in a standalone Part D as a companion to the Medigap policies. So here's some basics of the Medigap. I'm not going to go through all the details because there's a lot of information here, but the point is you'll see that you have different plans, A, B, D, G, K, L, M, N. C and F is for people that had Medicare prior to 1/1/2020, so those aren't really available anymore. But you'll see it covers Part A deductibles, Part B coinsurance, the Part B annual deductibles or excess charges, foreign travel, hospice. Again, you'll see all different plans. So this is where it's important to sit down with an insurance advisor, kind of walk you through which plan makes sense for you if you choose to go down the Medigap plan route. So kind of a little summary here of the basics. Guaranteed issue when you apply within 6 months of first activating your Part B coverage of original Medicare. There are some health questions when you apply for coverage more than 6 months after Part B. Now, there are some exceptions depending on the carrier. And usually carriers can use answers to the questions to decline coverage or increase premiums. So it's just something to be aware of. Some of the pluses of having a Medigap plan is that there are no networks. You can go to see any doctor nationwide. Now, there are some exceptions with Medigap Select policies, which is a whole separate presentation, but for the purposes of today, with Medigap or Med Supplement plans, there are typically no networks. You don't need prior authorizations or referrals, okay? You can work with any provider who accepts Medicare programs in all 50 states, and usually there's a flat monthly premium and often no or very few medical bills because the monthly fee that you pay helps fill the gap of original Medicare. Now, the pricing is based on attained age, so premiums can increase based upon the age you attain coverage, and they will increase with age. On average, now don't hold me to this, but on average, you're seeing the price of a Medigap plan to be about $150 to $300 a month, and then you have to add your Part B premiums and your Part D premiums on top of that. And you'll see a little bit later how those costs can increase. So let's break down the Part C. Part C is Medicare Advantage. So Medicare health plans options run by Medicare-approved and contracted private insurance companies, these plans must provide all the benefits that original Medicare often offers, and you get more because the insurance companies are offering more benefits to try to bring Medicare beneficiaries on board. It provides all of your Part A, hospital insurance, and Part B, medical insurance, coverage into one plan. It may offer some extra coverages such as vision, hearing, dental, or health and wellness programs such as free health club memberships. And most of these plans include a Medicare prescription drug plan, the Part D. So you can see it kind of as comprehensive coverage into one plan. So the basics of Medicare Advantage is that Medicare pays Advantage plans a specific amount every month to provide care to Advantage plan members. So these plans have to follow Medicare's rules. So for billing purposes, Advantage card is going to be your Medicare card and the only card you present to your providers. You can keep your red, white, and blue original Medicare card at home. Now you can change Advantage plan companies every annual open enrollment period with no health questions or pre-existing conditions. So those are the basics of Medicare Advantage. In addition, typically these Medicare Advantage plans are one of the lowest premium options out there, and most include Part D drug coverage that are built in. And you'll see whenever you meet with your insurance advisor that some plans even offer a 0 monthly premium. The caveat, though, is there's a network of providers, usually through an HMO, POS, or PPO plan. So there are some limitations as to who you can see because it's provided by these insurance companies. And for the most part, you're going to need prior authorization and referrals from a primary care physician. Coverage for emergency and urgent care can be anywhere in the U.S. Some plans even offer worldwide coverage, depending on the insurance company you decide to get for your Medicare Advantage plan. And the benefits and premiums can change every calendar year since it is with an insurance company. And it's more of a pay-as-you-go plan. So you're going to have co-pays, co-insurance, but the nice thing is that there are limits on the total calendar year and out-of-pocket exposure. So with the Medicare Advantage plan, as opposed to original Medicare, you have maximum out-of-pocket protection with a Medicare Advantage plan. That is huge. So you limit your exposure because medical expenses can be very, very pricey. In addition, with Medicare Advantage, you must live in a planned service area. It is usually defined by what county you live in. All right. So if you move to a different county outside of a certain geographic area, there may be a different plan for that specific area. So plans are regional. Again, so if you move out, they may disenroll you and you can then re-enroll in a new area. As I mentioned earlier, typically with Medicare Advantage plans, if you go with an HMO plan, that's probably the most restrictive when it comes to service area because you're going to be going through your primary care physician and then referrals from there. Those usually have a 0 monthly premium. Now, if you want a little bit more flexibility and want to be able to go to whatever doctors you want, you can maybe be interested in a PPO, preferred partner organization, but there's a little more premium to that, and that can be as low as $25, $250, or more depending on the plan. The nice thing though with these plans is that the copays and co-insurance are usually 0 premium to go see your PCP for the most HMOs plans. So then, which one do we go with, right? Do we go with the Medigap or Medicare Advantage? Well, there's pros and cons and considerations to both. When it comes to coverage, with the Medigap policy, usually it pays some costs that are not paid by original Medicare, but it does not help with drug costs. There is nationwide coverage, and then may offer some additional value-added services. As opposed to the Medicare Advantage plan, it provides benefits of original Medicare and beyond. It usually includes the Part D coverage, which is great. You want that prescription drug coverage in there. You may have a provider network for the most part. If it's an HMO, yes, PPO, more flexibility. And it typically offers some additional health benefits, the dental, the vision, the hearing. On a cost perspective, with Medigap, you're going to have monthly plan premiums and drug plan premiums and other costs if you have a standalone Part D plan and pocket cost depending on the plan you choose. With a Medicare Advantage plan, it may charge a monthly premium or not. As we just saw, there are some zero premium plans out there. It offers no additional premium for the drug coverage. Your co-pays and co-insurance for most covered services, so there will be $20 here, $15 there for co-pays and co-insurance. And you have an annual out-of-pocket maximum. When it comes to convenience, on a Medigap policy, there's multiple plans, as we saw, A, B, C, F, G, H, K, all those plans, when you add those to original Medicare along with the Part D plan. With the Medicare Advantage plan, it's kind of all in one. Kind of bundles all the services into one solution for you. Now, there's not necessarily one that's better than the other. They're just different depending on your specific situation. A Medigap policy might be the right thing for you, or a Medicare Advantage plan might be the right thing for somebody else. It doesn't really matter. What matters is what's good for you and what's going to work best for your current situation. And you're not beholden to one or the other. If you decide to go with a Medigap one year and you say, you know what, maybe the Medicare Advantage is the right thing for me, there are opportunities to make changes on an annual basis during the annual enrollment period. Now, just to compare some costs, you're going to get an idea on average what you're going to see. With those Medigap or Medicare supplement plans, you're looking at your Part B premium. We can't avoid that. That's something we have to pay no matter what. The $148.50 or more depending on your income. Now, if you choose a Med Sup Plan G as an example, that monthly fee could be $150. If you get a Part D prescription drug plan to add for that to your program, now you're adding up, say, $30 a month. So you're looking at total monthly cost about $328.50 on average for a Medigap or Medicare supplement plan. Now, don't hold me to that number because it varies from county to county, city to city, state to state. But on average, you're going to see about that expenditure on a Med Sup or called Medicare supplement plan. On a Medicare Advantage, you will have your Part B premium. Again, we can't avoid that. We have to pay that no matter what, $148.50. But on average, we see Medicare Advantage premiums that are zero on a monthly basis. Part D premiums typically are going to be zero with a Medicare Advantage plan, so your total monthly cost is $148.50 on average. So you can see, depending on your budget, depending on what's best for you, a Medicare supplement plan might be the best thing, or a Medicare Advantage plan. Each person is unique, so I can't say one is better than the other. Now, some resources for Medicare questions. First and foremost, we always recommend talking to a local agent. I mean, we know what's going on in the specific market that you live in. We know what options are available. We can help answer any questions or point you in the right direction. I encourage you to go to Medicare.gov and look at the 2021 Medicare New publication. That handbook has every single detail imaginable about Medicare. Or if you want to go down the Medigap route, there's also a 2021 publication for that. You're more than welcome to call 100 Medicare. Just be mindful those wait times might be a little bit longer than normal, but if you want to call them, you're more than welcome to. And of course, I just mentioned the Medicare.gov website has anything and everything you'd ever imagine about Medicare to answer all your questions. Again, I want to thank you for your time today. Appreciate you listening to our Medicare 101, a guide to basics Medicare. My name is Rodolfo Sierra. Thank you. You have a great day.